Is it possible to come back to life after death? Dr. Sam Pernia, a prominent intensive care doctor and researcher, says that it is possible. Here is why. A person is considered clinically dead once his or her heart stops and brain shuts down. That's what considered death until about 50 years ago. But a person's cells in the body, especially the brain cells, stay alive even after a few hours after the clinical death.
The cells inside the body, and particularly the cells inside the brain, do not suddenly become annihilated. They go through a process of decay that can take a few hours.
So with the advancement of medicine, it is possible to bring back a patient even after clinical death. Of course, it doesn't happen with everyone. It varies from patient to patient. The brain can be hypoactive during cardiac arrest, which has been observed in animals in different experiments. But is it true for humans as well? To learn that, they studied the brain signals for 4 dying patients before and after the withdrawal of ventilatory support. 2 out of the 4 patients showed the stimulation of gamma activity, which means that brain was active. Gamma activity means that the patient is possibly having a memory flashback of the important events of his or her life. Researchers from the University of Michigan discovered that areas of the brain responsible for interior visual experience were more active during cardiac arrest. A sudden surge in brain activity at the time of cardiac arrest may be what causes people to perceive a bright white light. That's why a lot of people who have been resuscitated from a clinical death situation will tell you that they saw a bright light. Some patients can recall events during the time of their cardiac arrest. They can hear and feel what is going on around them. However, other patients do not recall anything that happened around them. For the people who came back to life after a clinical death situation, the time in between varied. Sometimes it was minutes, sometimes it was hours. The longest I read is 17 hours. After the doctors left hope and took off the life support, the patient came back to life from being clinically dead. What happens during those clinically dead moments? What do they feel? Patient had different kinds of experiences. Some reported they went to heaven and came back. Some reported they went to hell. Some people reported they went to their past life. And some people reported they went to the future. A few features that were reported pretty consistently by the people who have experienced clinical death situations. A sensation of consciousness leaving the body, the feeling of drowning in a tunnel or darkness, seeing bright light as I mentioned earlier as well, mind functioning rapidly and more clearly, feeling a sense of peace and warmth, sense of abundance of knowledge or enlightenment, recalling important life events and memories, meeting the deceased loved ones or sometimes meeting religiously significant figures like Jesus. These are some common patterns. Those experiences are very profound and very true to them. However, scientific explanations for most of the experiences people reported after being resuscitated are not available yet. These kind of near-death experiences changed the outlook of the patients completely. They became more appreciative of life, lost the fear of death completely, they became more compassionate, more spiritually inclined, less interested in material wealth, and more loving to the earth and surroundings. But sometimes the experience is actually not positive. It can be hellish or fearful experience as well. A lot of research is still going on and probably will be going on for decades to come. Dr. Bruce Grayson studied over 1,000 cases of NDEs at the University of Virginia, shown in his research that these experiences cannot be dismissed as dream states or hallucinations. Near-death experiences are commonly described by 10 to 20% of cardiac arrest survivors. Every year, only in the US, 9 to 20 million people experience clinical death or near-death experiences. I hope this was informative. Please subscribe to stay tuned.